Thank you all very much for coming today. We are here to address a healthcare crisis in the province of Manitoba, brought on by nearly 2 years of healthcare failures by this NDP government. And now we are in a crisis, a healthcare crisis under this NDP government. This is not just me saying this. These are real examples of Manitobans that are experiencing these failures under this NDP government. Quote, Donna Buchanan spent hours in a bed soaked with her own urine earlier this month after home care nurses failed to show up for the weekend shifts. HSC nurses, I would say, and I quote, I would say, don't come here until our employer has made this a safe facility to work in. Everyone's at their risk now when you come to the HSC, end quote. Another example of a senior, and I quote, with me on oxygen and the heavy smoke from the wildfires, I'm told to stay in. And then I got a department telling me, quote, well, it's okay to go downtown and pick up a check. So I'm still in a quandary. They didn't give me any alternative, just go pick it up, end quote. We are in a healthcare crisis in the province of Manitoba. All of this culminated on Friday with the Greylisting of HSC by the Manitoba Nurses Union that warns nurses not to take jobs or shifts at HSC. Health Science Centre, the jewel of Manitoba's healthcare system, is now an unsafe workplace under this NDP government. Home care is now in shambles under the NDP's centralized scheduling system, which has failed patients for months. The NDP can't even get simple things right that have been working for decades, like mailing out checks to a 90-year-old Manitoban who needs that money. This is the very same NDP that promised voters they would fix healthcare. They said they had the answers. They said they had a plan. The NDP said they would fix healthcare. They spent an entire election on a promise saying they would fix healthcare, and nearly 2 years later, we are a healthcare crisis under this NDP. So today, we are calling on the NDP government to act now. Stop with the partisan attacks, stop with the blame game, and start working for Manitobans like you promised them you would. Enough with the talk, time for action. On that, I will open it up for questions from the floor. Thank you.
What kind of actions are you looking for here, Mr. Trump?
Well, I mean, you can look lots of actions, first of all. I mean, the NDP, let's not forget, they promised they would fix healthcare. And healthcare is significantly worse than what it is. But if you want real concrete action, you can just look at the Manitoba Nurses Union. What do they ask for? They ask for safety in their workplace. They ask for swipe cards to access hospital tunnels. They ask to create an early alert system to warn staff, and they ask to make sure controlled entrances and staff are maintained. That can all be done today. The Minister of Health and this NDP government have the authority to do those things today, and they are choosing not to. So what would I do? I would do those asks. Why the NDP aren't doing it? You would have to ask them, and that's why we're in a crisis.
The Nurses Union says that they've been considering greylisting HSC since 2020, which is when PCs were the government then. What did they say to your government about the issues then, and what did you do about it?
Yeah, so I know I've read that report as well, and in 2020 they were considering greylisting, but they didn't. So what we're dealing with today is they've actually greylisted. 94% of Manitoba Nurses Union have voted to greylist. That's the crisis we're in today. The crisis that the NDP said they had answers for. The crisis when you have seniors, vulnerable Manitobans lying in their urine for hours and days. A crisis when this NDP government says to a 90-year-old Manitoban who's on oxygen, go pick up your check with your oxygen tank. That's how you're going to get money to survive. This is a crisis, and there's tangible asks by Manitobans to fix these problems, The NDP are refusing to do them.
Regarding the mailing of the checks, the person says that the decision has been reversed. There is a given because the strike is not imminent. Do you think the government rushed the decision to cancel the checks?
Sorry, can you repeat the question again?
Do you think the government rushed the decision to cancel mailing the checks out of concern over the potential strike?
Look, I think it's very clear that this NDP government has made a lot of announcements, had made a lot of promises, and has not really thought anything through, right? When it comes to this check, there's a great example. You have a 9-year-old Manitoban, and who knows how many others. Your mom, your father, your grandparents are in this same situation. How many other reports have come forward with stuff like this? The NDP love to make announcements, they love to take pictures and smile in front of the camera, but when it comes to doing the hard work, we have seen time and time again, they are failing. This is just another example of that. Look at the scheduling debacle under this NDP when it came to that. This health minister accused our health critic of fear-mongering. Well, are the seniors that are coming now and the Manitobans that are coming forward now fear-mongering as well? Or is this the reality that we said was happening? And the NDP refused to listen then. Oh, it's a little glitch and we'll fix it. Now we're in a crisis.
These are all stories that have hit the news.
Yeah.
Have there been any patients come forward to your office with other concerns that have stood out to you?
Yes, there's been lots of them that have come forward to not only myself as the leader of the opposition, as the MLA in Fort Wright, but also to a lot of our colleagues. The health critic as well. I have colleagues on both my sides here. Lots of stories have come forward, and this is why it's really a crisis. These are just 3 or 5 stories that have been written. But that's just the tip of the iceberg. We have 6 people who have been sexually assaulted in the past few weeks at HSC. We have the HSC hospital, which has been greylisted only 5 times in its history under this NDP government. We have a health minister who says the system has failed Manitobans. Well, maybe the minister needs to look in the mirror because they are the system. They are the ones in charge of providing these services. So they are the ones that are failing Manitobans. They are the system. We are here in oppositions to hold them accountable to Manitobans, to hold them accountable for their promises and their broken promises. And the Manitobans that are being affected, that don't feel safe going to the workplace, that are being sexually assaulted, that are being left for weeks on end unattended in their homes when they need home care. It's tragic.
Do you have any other specific calls to action here today, or are you echoing what the nurses have said?
Well, we're echoing what the nurses said. We're also stating that they need to get to work. Enough with the blame game. They need to actually do what they said they were going to do, or come forward and admit that they have no plan, and they never had a plan. And their plan was simply to take pictures, tell people what they wanted to hear, and not actually deliver on anything that they promised they were going to do. We're in crisis here. We know there's a doctor shortage. Nurses are now, the HSC is greylisted. Seniors can't get home care. People with disabilities that need help can't get it. Where's the health minister? Where's the premier? Why are they not taking action on these tangible fixes? It's really a state of crisis right now that we have a failure by this NDP government. So my job as a leader of the opposition is to stand up and advocate for those Manitobans that need that help.
Anything else, guys? All right, thanks.
Awesome. Thank you all very much.